we didn't think it was COVID or anything at first. It was, it kind of just happened very quickly all of a sudden.
As the case count continues to soar, the human toll from the COVID-19 pandemic marches grimly on in Ontario's long-term care facilities. As a family lays to rest a beloved grandfather who died suddenly this week, just 5 days after falling ill.
We really only had like a day to say goodbye to him.
Oh, man.
Philip No tells me he was very close to his grandpa No, raised by him even. Chin Long No had been a resident at North Park Nursing Home for about 2 years. While at age 88 he had some health problems, Phil tells me he was vibrant, of sound mind, alert and social, dispensing life advice to Phil on his 30th birthday, just days before Grandpa died on November 10th. His virtual funeral was yesterday. He'd been tested for COVID several times after he got sick, which all came back negative. It wasn't until the day before he died, when he was on a ventilator struggling to breathe, that his test was positive, and his family knew the end was near. But they could only look at him from behind a glass partition.
You know that's going to happen, but you can't really hold him. You can't kiss him. You can't, can't even be near him, right?
North Park Nursing Home near the 401 in Keele has been hit hard by the coronavirus. It's a small 75-bed facility where an outbreak has infected 45 residents, or 60%. As well, 22 staff members have contracted it, and there have been 7 deaths there. The government is scrambling to contain the spread of the virus in long-term care facilities across Ontario, where more than 70 lives have been claimed in just the last week alone.
We're making sure that we're doing everything absolutely possible in our powers to continue enhancing the iron ring, as you may say, around long-term care.
This is such a new thing for a lot of people.
Even through his grief, Phil No says North Park gave his grandpa good, loving care, and he doesn't blame them for what happened to him. And adds that the facility has done what it can to follow health protocols. But he says they're dealing with an insidious predator.
However it does get in there, that's really all it takes, right? It's just like one mistake or one event.
Yeah.
And that nursing home is fighting an uphill battle.
Phil feels like it is up to all of us to take this seriously, that what we do in the community has consequences, and we all have a part to play to stop the spread of COVID-19.
You don't think about this stuff until it actually happens to your family. What people do outside in the community does trickle down and affect other families in places like long-term care. Mm-hmm. And people should be aware of this before they go out and start doing things that, something that you think is simple and harmless does have consequences to other people's families.
Pam Seatle, City News.